Now to a GMA Health Alert, the new test that claims to help mothers determine the nutritional value of their breast milk. The CDC says more than 80% of new moms breastfeed their babies at birth, and the company that makes this test hopes to help them make sure their babies get what they need. New mom Casey Gorham said she first noticed that her son Sequoia was having problems gaining weight 2 weeks after birth.
My baby just kept getting smaller. His arms were getting smaller. His bones were sticking out, so he just looked small. It was very concerning, especially as a first-time mom. He's so much better now.
After consulting her pediatrician, she began using a new breast milk testing kit from a company called Lactation Lab. The company measures calories, carbohydrates, protein, and fat content present in a new mom's breast milk. A frozen sample of the milk is shipped to the Lactation Lab, and results are sent along with nutritional recommendations to improve the quality of the breast milk.
As we were making changes to my diet, he started gaining weight. My calorie count went up for my milk. The kit really helped me and just reassured me a lot.
The test was invented with the goal of helping breastfeeding moms with nourishing their babies.
This is sort of like a food label for your breast milk.
UCLA doctor Stephanie Canali says she developed the test out of her own frustration as a working mom of two after her second child's weight stalled through breastfeeding.
I felt like a failure. I really don't want another mom to go through what I did or feel like the way I did.
Dr. Canali says their test is evidence-based and cited her own study of 30 women who learned about what was in their breast milk.
They were given specific dietary recommendations, and then they retested their milk. And those women actually went on to breastfeed for longer than expected because they were reassured.
Of the 30 women, 28 reported they continued past the 6 months of exclusive breastfeeding that the American Academy of Pediatrics recommends. But it's not clear if the women would have continued anyway. Lactation Lab isn't alone in offering these tests. Companies like My Milk and Everlywell also offer them, but the tests aren't cheap. Lactation Lab charges $99 for a basic evaluation and $349 for premium kits, which also measure fatty acid and so-called toxins. Currently, there are no independent studies that verify the accuracy of these tests.
I'm not certain there's any rigorous study or any documentation that the science here is really proving useful at uncovering or covering challenges that moms are having with breastfeeding. I think this idea that a one-time or a one-day, one-ounce sample of breast milk could be wholly reflective of their ability to be a great feeding pair with their baby is misleading and deeply concerning.
Let's bring in our chief medical correspondent, Dr. Jennifer Ashton, who was nodding her head, shaking her head throughout the entire piece there. So it sounds intriguing.
Right.
What's your take?
Here come the qualifiers, Amy. First of all, interesting, yes, there is not yet conclusive peer-review scientific or nutritional science data to support this use widespread for breastfeeding women. Is it interesting to talk about the nutritional impact that a breastfeeding mom can have on her baby? Absolutely. Can it increase awareness? Absolutely. Can it also potentially increase anxiety, fear, doubt, guilt? All of which are already present in spades for most new moms. Yes. So it's not yet ready for prime time. It does have some anytime we talk about nutrition, I'm interested, but this is not yet standard practice recommendations by pediatricians, OBGYNs, or lactation
You're literally the perfect person to talk to. Someone who's delivered 1,500 babies and has a degree in nutrition as well on top of being an OBGYN. But should new moms be concerned about the nutrition of their breast milk?
Well, here's what we need to remember. If you talk about breast milk 101, human breast milk, number one, it is truly the perfect food because it contains fat, it contains protein, it contains carbohydrates, and obviously very important for the immunity of a new baby. However, and here is where this test has issues, it varies woman to woman, hour to hour, day to day. The breast milk at the end of breastfeeding, one session, right? That's right, is different than at the beginning of a session. The hind milk is really where you get all of the nutritional bang for the buck, the fat. So again, to imply that one point in time can dictate the entire nutritional status of a baby or the breastfeeding mom is just not really accurate yet.
And you addressed this, the social and emotional pressures placed on new moms, especially when it comes to breastfeeding. What's your advice to them?
Listen, medically, breast milk is best for both baby and mother, but logistically, emotionally, many women can't or they choose not to. So what I would tell new moms is the operative word in breastfeeding is feeding. You should feed your baby the best way for you and that baby with no judgment, no shame in the game, and everyone else should stay in their lane.
Well, and I second that, because everyone has an opinion about what you should be doing.
That's
so we
right.
appreciate that, Dr. Jen.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.